Moments ago, we got some headlines that the mask mandate for planes and trains have been overturned by a Florida judge. Talk to us a little bit about what the loss of the mask mandate would mean in the long-term fight for fighting COVID.
Yes, it's just one of our major measures, right? Masking, social distancing, these are important measures that we have to protect people from having COVID. Right now, we've got Omicron, and we know that it tends to lead to a milder outcome given the number of people who are already vaccinated. But we have a lot of vulnerable people in our population, and there is a lot of risk to them who have to take public transportation, especially for work or for other purposes. So I think it is a hit overall.
Sorry about that. No, I mean, the other factor is the people who are still struggling with long COVID. You've done a lot of work on that. Can you talk to us about what the process of getting the right information all together to properly track the long-term road ahead on long COVID looks like right now?
Yeah, so the hardest part with long COVID is really getting good numbers, trying to understand who has it, what are some of the risk factors, and then what are these outcomes that we're seeing. You know, as we're living through this pandemic, we're sort of watching people continue to have long-term symptoms or develop new symptoms that are related to their initial infection. And now we've got people a year out that are experiencing, you know, fatigue, shortness of breath, cognitive disabilities, and others, including new heart conditions and other things that are really disturbing to us because of the number of people who have had COVID. And of course, the other part that's really confusing is that it's not just the people who had severe infection or who are hospitalized, but it's also people that have had mild infection, which means that pretty much anyone is at risk of having long-term symptoms.
Talk to us a little bit about where the role of underlying conditions falls into that, whether it's asthma, diabetes, even allergies. How much worse does that long COVID get if you have those underlying conditions?
That's a really great question, and that's one we're trying to understand. What we see right now is that age isn't seeming to play a factor. So unlike with COVID and severity of COVID, where older people tend to have worse outcomes, we're not seeing that with long COVID. It affects all ages, including children, but it definitely affects those in that sort of working mode of 20 to 50 years of age. In terms of predisposing conditions, we haven't yet seen a smoking gun. We haven't seen something that would tell us, okay, it's because you had diabetes or you had asthma. A lot of the people that have long-term symptoms actually were very healthy individuals. Some were marathon runners, young people in their 20s who went to the gym every day. These were not people who had a lot of pre-existing conditions. So it's not clear to us at this point that that's playing a major role.